direction. So can we talk a little bit about burnout? What do you think that's how's that playing a role in this dynamic?
Well, since you bring it up, um, the studies have been coming out over the last now many years, and has been intensified through COVID. Is that the
Right.
burnout rate is at least half the docs, and the old joke there is half the docs are burnt out, and the other half just lie about it, because the pressures of the job are just so enormous. So where do I think it's coming from? Well, first of all, the definition of burnout is by Christina Maslach, who's one of the godmothers of burnout. And the definition is based upon people feeling emotionally exhausted, cynical, and feeling like whatever they do is not meaningful. It's the personal accomplishment is low. So if you have any one of those three, then by definition you have burnout. So when they say half the docs are burnt out, when they answer surveys, they answer positive to one of those three areas. The other thing about burnout that I keep in mind is that trying to solve the same problems over and over, that could burn people out also. So where does it come from? Well, if you look at the studies, it comes from docs doing a lot of things that docs never really signed up for. So all the bureaucracy that needs to go
Right.
into it, all
Yeah.
the regulations, all the documentation, all these things that all we really want to do is take care of people, interact with people, and make people better. That's what we want to do. What we don't want to do is all this other stuff. And what we don't want is to be intruded upon by outside forces, which have really integrated themselves into medical practice. So where does it come from? It comes from there. And it's really the burnout also might be associated with something called moral injury. And that is to say, when you have somebody doing something that they know is not right, then it creates this additional pressure on them. So, as an example, you know, when I was back in practice, and I'm still very clinical. I still do all and I'm an endocrinologist, so I do all the endocrine consultations at our hospital, and I oversee our diabetes program. So I'm very clinical. But when you have people who are in private practice being told that they have to see a certain amount of patients in a certain amount of time, that goes against their grain. It's not how we were trained. And but we're asked to do these things, and we're kind of pushed to do these things because many of us are employed or based upon reimbursements. We feel like we have to see a certain number of patients to not only to pay our expenses, but also to take home a living that we think is commensurate with the amount of responsibility that we are put upon us. So moral injury is, if you ask doctors when they signed up to go to medical school and become a doctor, and they weren't doing it because they could see a patient every 10 minutes. They were doing it because they wanted to take care of people. And now all of a sudden they're asked to do it, see more people, and do it quicker. One of the reasons why I left my private practice was I was employed at that particular time because I thought that was one of the ways I could survive all the outside influences on my practice. But when I was leaving private, I was actually giving an ultimatum. I was working so hard. I mean, 80 hours a week would be part-time for me. It was all day, every day, nonstop. And so and I was on the list of best doctors in America every year, annually, and I had a waiting list 6 months long for people to get in. But the people who own the practice said, you got to see more patients. And I said, I cannot physically see more patients. They go, well, we're going to cut your pay. And I go, first of all, as an endocrinologist, we're one of the lowest paid specialties to begin with because we don't have any procedures. And I said, well, that would be wrong to cut. Why would you cut my pay? I'm playing at the highest level possible. They go, but you got to see more. I can't see more patients. So I was left with an ultimatum. Do I continue to practice the way I want to practice, but be penalized financially, or do I want to say there's got to be a better way?